Let me thank everybody for being here, and let me thank our very esteemed panel of people who have spent their entire lives fighting for quality health care and disease prevention in this country. Let me just very briefly introduce some of our panelists before we begin. Dr. Abdul El Sayed is a physician, he's an epidemiologist, he's a public health expert, and former health commissioner for the city of Detroit. He was formerly a professor at Columbia University's Department of Epidemiology and a director of the Columbia University Systems Science Program. Dr. Allison Galvani is director of the Yale Center for Infectious Disease Modeling and Analysis, and Burnett and Stender Family's professor of epidemiology. She is the youngest recipient of an endowed chair in the history of Yale School of Medicine. Dr. Victoria Dooley is a board-certified family medicine physician and healthcare advocate, and has worked very hard to make sure that all people in Michigan receive healthcare as a human right. Deborah Berger is the National Nurses United president, and the National Nurses United is the largest nurses union in the country, and she is one of the country's top nursing leaders and an outspoken advocate for healthcare for all. Greg Whitten is the former Special Assistant Secretary of Defense for Nuclear, Chemical, and Biological Defense Programs at the Department of Defense. Mr. Whitten worked for the Obama administration and will speak to the creation of a defense response to epidemics and how the Trump administration has failed. I think the main point that I want to make before I turn it over to the experts is that when you have a global infectious crisis which is endangering people all over the world, the people of the United States, and in fact the people of the world who look to the United States for leadership, want to know that we have an administration in this country whose decisions and comments are based on science, not based on tweets that have no scientific basis, not based on politics, not based on policies designed to protect the wealthy and the powerful. And let me just quote, if I might, just a few, and there are many more, comments made recently by President Trump. President Trump, I think, is quoted as saying that he has a natural, quote unquote, a natural ability, end quote, to understand the coronavirus, and that virus will end by April. Donald Trump does not have a natural ability to understand the coronavirus, and his reckless statements are confusing people in this country and all over the world. Donald Trump has congratulated China on its effort, when in fact the entire world community understands that because of the lack of transparency in China, this situation is much worse than it should have been. Donald Trump has said that, quote, so if, we have thousands or hundreds of thousands of people that get better just by, sitting around and even going to work. Some of them go to work, but they get better, end of quote. Here you have an incredibly infectious disease, and the whole world is wrestling with how we prevent the spread of that disease. To suggest to people that when you are sick, you go to work might be the stupidest advice ever made by a president of the United States, and on it goes. So the first point that I want to make is that we need an administration whose efforts are based on science, and that means that we should not have somebody like Vice President Pence heading up the coronavirus task force. That task force should be a 100% non-political task force led by our best scientists and public health experts, not politicians. If there's ever a time you don't want to mix politics with a healthcare crisis, this is that moment. Further, and importantly, we remain, as all of you know, the only major country on earth not to guarantee healthcare to all as a right. And the absurdity of that situation becomes clearer every day. And while we must move toward a Medicare for all healthcare system so that every person in this country has healthcare as a right, what we must do right now, today, is make sure that every person living in this country, right now, including the undocumented, I may say, must be able to go to a doctor or a hospital in order to determine their health status. In other words, we do not want anybody who is sick today, who is saying, well, you know, I have some symptoms, but I'm not going to go to the doctor because I can't afford it. Mm-hmm. That is horrific for that person, and certainly for anybody that person has contact with. The federal government right now must make sure that we are paying all of the costs for those doctor and hospital visits. In the midst of a potential pandemic, no one should be stopping themselves from going to a doctor simply because they are afraid that they cannot afford it. Mm-hmm. Furthermore, at a time when half of the people in this country live paycheck to paycheck, and when people go to work every single day, even when they are sick, because they need an income to take care of their families, the United States remains the only major country on earth not to guarantee paid sick leave and paid family leave. Now that is absurd in a general sense, but it is particularly dangerous given the moment we are at right now. And that means that today there are people who are going to work who may well have symptoms of the coronavirus or other illnesses. And in the midst of this crisis, when we do not want people going to work who are sick, who may have the coronavirus, we must guarantee that all people who do not go to work or self-quarantine themselves because they think they may have the virus receive a paycheck to keep their families and their own lives going. Not a radical idea. If we were living in the system we want to live in, that I want to see, of course everybody would have paid medical leave. But we're not there. But in the midst of this crisis right now, I don't want anybody, because of lack of income, to have to go to work and perhaps infect others because they're afraid they're not going to receive an income to take care of their families. Further, it goes without saying that the United States must work with scientists around the world to aggressively develop a vaccine for the coronavirus. The Trump administration has suggested, as some of you know, that the vaccine might be too costly for some people to afford. How vulgar, obscene is that idea? That you're rich, you can get the vaccine, you're poor, you can't get the vaccine, you're gonna die, you're gonna live, so that the drug companies can make their outrageous profits not acceptable to the American people. When that vaccine is developed, and it must be developed as quickly as we can, working with folks all over the world, obviously, it should be made free to every person in this country, and in fact, every person in the world. Furthermore, right now, there are doctors, and we'll hear more discussion about this in a moment, there are doctors and hospitals that do not have the necessary testing kits that they need in order to determine whether or not people have the coronavirus. And there are hospitals all across this country today, even before the coronavirus, who do not have the necessary ICU units that they need. And obviously that is an issue that we must focus on. Every hospital in America must have the proper number of ICU units, and every doctor's office in America must have the testing kits that they need. Furthermore, and I think Deborah Berger will talk about this, the federal government must make certain the doctors and nurses and all medical personnel have the knowledge and protective equipment they need in order to remain healthy. Now, we want everybody to remain healthy. But if our frontline fighters in the struggle, doctors and nurses, go down because of the illness, who is there to protect the American people? So we have got to be working overtime to make sure that every doctor, every nurse, every medical professional in this country has the equipment they need to protect themselves and the knowledge as to how they can protect themselves. The United States government clearly must do a better job working with other governments around the world. This is not an American issue. This is a global issue impacting countries in every part of the world. And we have got to be invested in and working with the World Health Organization and other international health organizations. And again, what I think frightens the American people is that today we have a president of the United States who doesn't even recognize the reality of climate change, let alone understanding that we've got to work with the entire global community to address this crisis. So those are my perspectives as a United States Senator of what the government should be doing. But now I want to get to some of the medical professionals and get their specialists' perspective on the crisis. Let's begin with Dr. Abdul El Sayed. Abdul.
Thank you, Senator. So I'm going to be talking specifically from the background of having been a health commissioner. And that perspective is really focused on trying to understand the phases of epidemic response and where they might have gone wrong and what it would look like if they went right. The first phase is just ascertainment that there is something wrong. Our country's focus on this has really been framed around a global health security agenda, which I hope Greg will speak to a little bit more. But that agenda was born out of the Ebola crisis that thankfully was largely relegated to West Africa because of the heroism of our U.S. Public Health Service and our CDC. And learning from that experience, they decided, you know what, we need to make sure that we have bases worldwide, 49 different countries, where we can be constantly looking to surveil. For the past several fiscal years in a row, that funding has been put on the chopping block, 80% of that funding, taking us from 49 different countries to 10. And it's not that that funding actually went through. Thankfully, the leadership of Congress stopped that from happening. But you can imagine working in an institution where every year you're told you're about to get cut. How do you plan long term? What does that do to the work that you do day to day, keeping us safe abroad? The second point is that this emergent pathogen occurred in a time of international conflict between the United States and China in the form of a trade war, which you have to ask, how do you actually work with another sovereign nation when you're hearing in the media all day that these folks are trading jabs over trade? And so that might have curtailed our ability to engage in that context. Then you get to containment, and containment means painstaking work of identifying everybody who's been exposed to the virus and then figuring out who they may have exposed and either subjecting them to quarantine or isolation depending upon their exposure status. But here's the problem. In order to be able to do that and do it well, it takes a whole lot of human power. What happens when you can't rule out a case among somebody who's been exposed? What happens then is you say 3 people were exposed, all 3 people you have to assume plausibly have the virus, which means that you then have to trace all 3 of their contacts, right? Which then gets to 9 if they all have 3, and then 27, and it keeps going. So with limited resources, because public health funding has been cut over and over and over again, you realize that without the ability to say that person's definitely not a case because we didn't have the testing kits and the capacity to do that, what happened is that level of folks you had to contact trace to exploded quite quickly, overwhelming our ability to do this basic work of containment. And then lastly, we're now at the cusp in a number of communities where we go from containment, where you're focusing on every individual case, to mitigation and control. That means large-scale societal interventions around reducing the amount of admixture between people such that you're reducing the virus's flow between people. The challenge with that, though, as we all well know and we're all seeing and the stock markets are telling us, is that these can be extremely challenging for society and for the economy, because stopping the flow of people is basically stopping the flow of the economy. And we're at that point now in a number of these outbreaks, specifically Washington state, where we are now moved from containment to mitigation. The question becomes for us now is, as this moves across the United States, certain communities are going to be able to contain. What does it take for us to invest in their capacity to do so that we can avoid some of the more troubling, the more challenging mitigation measures that we might need to see? And so I want folks to be thinking about the dynamics of that. What does it mean to have the resources you need to do basic public health work? And where has the CDC's funding been over time? And more importantly, potentially, where has state and local public health funding been? We've seen a stagnation, if not a decline, since the Great Recession. And what will it mean for us, right, where we're in a position as a society where we've got to be investing in the kind of mitigation efforts that put a huge damper on our ability to be and do as we usually be and do, and what the consequences will look like for poor and working people, for small businesses, and entire sectors of the economy. We didn't have to be here. We should not have been here. Had we invested in public health appropriately, had we invested in our international capacity to ascertain and take on these emerging infectious diseases in the moments that they emerged, we would not be here as a society. Our country has done that work in the past, and under this administration, that's failed.
Thank you very much, Saeed. Let's
Trust was instrumental to the timely hospitalization of cases, which in turn played a fundamental role in curtailing the epidemic. Similarly, accurate, honest communication that people can trust is essential during this crisis. As Senator Sanders highlighted, COVID-19 is exposing the systemic frailties in our pandemic preparedness. For the millions of people who are uninsured or underinsured, the medical bills that could be incurred may be a very real deterrent from seeking health care. Compounding the problem, families living paycheck to paycheck will disproportionately be impacted by control measures such as school closure. We need to ensure that people have the means to stay at home if they or their children feel unwell. We also do not have adequate ventilator and ICU capacity to handle the likely growth of the pandemic. According to our epidemiological simulations, it will only be a matter of weeks before critically ill COVID-19 cases exceed the number of available ICU beds. We evaluated a range of scenarios across different levels of key parameters. Despite empirical uncertainties and stochastic factors, for the vast majority of scenarios, at the peak of the epidemic, we will need many more thousands of ICU beds and ventilators than are currently available. The majority of infections are very mild. Of course, that is good in a sense. However, the problem is that mild infections can still transmit COVID-19 to people who may be vulnerable to severe infections such as the elderly. This makes the outbreak challenging to control and makes extensive diagnostic testing paramount.
Very much to Galvania. Dr. Dooley is a family practitioner here in Michigan, and like many thousands of family practitioners, she is on the front lines and has to deal with this crisis on a day-to-day basis. Dr. Dooley?
Well, when you look at the symptoms of this virus, they're pretty nonspecific: fever, cough, maybe some shortness of breath, runny nose, and that's pretty much what I see all day, especially at this time of the year, with the flu season ending and it being a bad flu season. So what does that mean for me and my patients? Well, that means for people who have mild symptoms, they don't want to go to the doctor and pay their copay and their deductible to find out they have a virus, and all they need to do is stay home and drink more fluids. So they have obstacles and hurdles to getting to my office because of financial reasons. And the people who do make it to my office, currently we have such strict guidelines as who can be tested, meaning where you have to have a known exposure, whereas we just discussed People can have mild illness. So right now in Michigan, you can only get tested if you have a severe illness and you're in the ICU, or if you know that you have been exposed to coronavirus. But how are we supposed to know when the symptoms can be so mild? So we are not testing enough people. So there is a shortage of testing, and that's going to lead to more people getting sick. We are not testing the amount of people that we need to test. So yes, the state can say, oh yeah, we have X amount of tests on hand. We have enough tests to test people. But if you're only testing people who obviously have the illness, then no, you're not doing enough testing. And so people who are most vulnerable, like people living with diabetes, a lot of people living with diabetes cannot afford their insulin because of the way our health system is now. So you have people who are vulnerable who can't even afford to take care of their chronic illnesses, and then those people living with chronic illnesses are going to be the most vulnerable people to pick up illnesses like this. And then you have problems with things like masks. In my office, I cannot order the masks that I need to protect myself, to take care of my patients. And when doctors and nurses are exposed to mild cases because we are not testing appropriately, we're not mass testing people, then what happens when we all get sick? Then you have no doctors and nurses to care for you. So I feel like if we learn anything from this epidemic, and this won't be the only one, in Michigan specifically, we recently, a few years ago, had an epidemic of hepatitis A, and that's a virus that is transmitted through food and food care workers, because we don't have a livable minimum wage in this country. When they're sick, they can't get to the doctor. And the only way we got a hold of that epidemic is by making the vaccine for hepatitis A free, and the health department and other places making the vaccines free. So if we learn anything from this epidemic, I hope that we learn as a nation that we all deserve health care, we all need health care, and that it should be free at the point of service for everyone. We deserve health care in this country, not just wealth care.
Dr. Dooley, thanks very much. Deborah Berger is the president of the National Nurses Union, the largest nurses union in the country.
Good afternoon, everyone. I want to thank Senator Sanders for inviting us to come share our expertise on COVID-19 and, most importantly, for showing leadership in this health crisis. My name is Deborah Berger, and I've been a registered nurse for over 40 years, and I'm president of National Nurses United, the largest union and professional association of registered nurses in the country. As you all know, nurses are on the front lines of our healthcare system, and at the same time, we're also scientists who understand well how infectious diseases spread. So we are uniquely positioned to recommend what we need to do at the ground level in our healthcare facilities to contain and stop the spread of COVID-19. As union nurses, we have the freedom and protection to speak up on behalf of ourselves and our patients. Our goal is to protect the health of our patients and the public, as well as our nurses and our colleagues. Nurses are eager to take care of patients and make sure that our communities are safe. But we need the right staffing, equipment, supplies, communication, and training to do this safely. Put simply, if we are not protected, our patients are at risk. This became clear at UC Davis Medical Center in Sacramento when one COVID patient resulted in the quarantine of 124 hospital workers, including 36 registered nurses. That means that the burden of taking care of all other patients in the hospital is putting a burden on the remaining nurses and other workers in that system. Nurses follow the precautionary principle in our approach to COVID-19, which is another way of saying, better safe than sorry. It also means that you always take a safer route, wear the higher level of protection, adopt a stronger standard, even when you don't know for certain that there is something dangerous or not. This is particularly important when there is very much we simply don't know about this virus. But this is not the approach of the Trump administration. The federal, state, and local agencies have taken. A recent survey of nurses conducted by us across the board shows that a majority of our health facilities are nowhere near prepared to handle this virus safely. They don't have the equipment, they don't have the stockpiles, they don't have the isolation rooms, they don't have the procedures, and they aren't communicating with their staff. They have no plan. Instead of relaxing standards and efforts, which some agencies have urged, we need to be stepping it up. National Nurses United has petitioned OSHA and the CDC and many agencies in California, the epicenter of the disease here in the United States, to do just that. We look forward to helping them implement our regulations. And again, thank you, Senator Sanders, for this important event. I'm very happy to be part of the discussion and answer any questions.
Thank you very much, Deborah. Greg Whitten is the former Special Assistant for Nuclear, Chemical, and Biological Defense Programs under the Obama administration. Greg?
Thank you so much, Senator Sanders. So my name is Gregory Whitten, and I served in the Obama administration as a political appointment for 7 years as the Special Assistant to the Assistant Secretary for Nuclear, Chemical, and Biological Defense Programs. I'm here today to talk about how our diplomatic effort through this disease and this pandemic, and how we can re-bridge what we did in the Obama administration and what Senator Sanders has been talking about for a very long time. The Trump administration has made us isolated from a lot of the world, and specifically the trade battle and everything with China has caused us not to be able to share and transmit data about severe diseases like this. SARS, MERS, this is one of them, one of those diseases, but this isn't going to be one of the last diseases that's going to come ashore, and they're going to get more and more virulent, and they're going to get more and more ability to spread, and we need to be a part of the global disease community and the ability to work with the WHO and work with our allies, but also work with not our allies to be able to transmit data so that we can all be safer. I look forward to today answering any questions, and I thank you for having me here, Senator.
Greg, thanks very much. I want to ask the panel some questions, but before I do, so I want to pick up on a point that I think many of the panelists have already made, and that is how far we are behind in so many basic needs compared to other major countries, and we're the richest country on earth. Now, in the city of Detroit, and somebody correct me if I'm wrong here, in this one city, there are tens of thousands of homes where people cannot access water, that their water has been shut off. Can you believe that in the year 2020, in the richest country in the world, in a major American city, people have no water because they cannot afford to pay their water bills? Now, we are told, everybody up here, all the doctors will tell you, you know, especially in this moment, wash your hands, right? Well, a little bit hard to wash your hands and keep clean if you don't have running water because you're too poor to pay an outrageously high water bill. Now, I'm glad, and I want to say this, that in the midst of the crisis, as I understand it, the city of Detroit today has stopped the water shutoffs. And that's a step forward. And I hope every city in America does the same, because people can't be clean if they don't have running water. But that just gives you an example of how far we are behind the rest of the world in dealing with basic human needs. Let me open the discussion here, and I'm going to start it off with Abdul, but other people can jump right in. I think, given the fact that we're not getting good science from the Trump administration, people would like some kind of expert knowledge about where do you think things are going to go in the future. Where are we going to be a week from now? Where are we going to be 2 weeks from now? 2 months from now? I know nobody can predict with certainty. But Dr. El Sayed, why don't you start it off? What's your best guess? Then we'll go to Dr. El Gavani and the epidemiologist among us here.
So just sticking very, very close to the evidence, if you look at the studies that have been published out of Wuhan, China, where this pathogen originated, we often look at two numbers. One is called the R0 value. You can look at it, it says it looks like R0. And that's the number of cases that you expect to emerge from any one infected case. And then the second one is the doubling time, which gives you a sense of how long does it take before one case turns into two turn into four, et cetera. And in the Wuhan studies, you're looking at about 7.5 days doubling time, putting it as an R0 of 2 to 3. But if you actually look at the cluster in Washington State right now, that doubling time is 6. And we know that that doubling time can change based on the density of a particular community and how ready the public health infrastructure is to absorb a new pathogen. And so we're looking at a doubling time of 6. Right now, the latest estimates suggest to us that we're right around 500 cases, which if you just followed that math, by this time next week, you'd expect about 1,000, and you keep going from there. My hope is that our public health infrastructure is strong, and that we're going to start seeing a capacity for containment in some of the communities that have not been hard hit or do not have yet have a case, because they've had the time to ramp up, and also because we hopefully now will have more of the testing kits that are needed to be able to support the containment efforts that I discussed earlier. But the challenge here, right, is we know that this virus doesn't affect everyone equally. For younger folks, for folks without chronic disease, the probability of serious illness is relatively low. Probability of death is even lower. But among folks who are seniors or potentially have chronic illness, that probability is substantially higher. And that's why, unfortunately, if you look at the outbreak cluster in Washington State, that's the picture that it's the never event that you never want, but that's the picture where you have a group of folks who are particularly vulnerable to both a serious illness after acquiring the pathogen and to death in one community space where it may pass between them. And those are the kinds of spaces that are going to be hit the hardest. The consequences, as Dr. Galvani talked about, is that this is really going to stress our healthcare system. And we really need to be thinking about what it means to ramp up early to anticipate the number of serious illnesses that will require ventilator capacity ICU with ideally negative pressure rooms so that you're not passing the disease out of those rooms. The other thing that I'll say just on that front is that the mitigation protocols that we can expect are going to include, as we've seen in Washington State, mandated reductions in congregation, limitations on public transit, reduced interstate travel, and potentially closing public schools and workplaces. And the consequences of that for the economy, as the stock market this morning is showing us, can be dire. And the cost of that is going to be far worse among folks who are living paycheck to paycheck. Because you got to imagine, right? Let's say you're working as a waiter or waitress at a restaurant. Folks aren't going out to restaurants in this context. You're living tip to tip, and that goes away. And so we have to be thinking not just about mitigation to protect our most vulnerable people, but also be thinking about mitigation for the economic and social consequences that will really hurt people who, because of the system we live under right now, are barely making it as it stands.
Thank you very much. Dr. Galvani?
I can address the question by talking about cases that will need ICU treatment specifically. So we have a range of scenarios that we've simulated for different R0 values that Abdul just mentioned, and also under different assumptions of self-isolation. A lot of people will start mingling less socially, and that will reduce transmission. So I do expect that transmission rates will be declining. However, even said that, for relatively conservative scenario of an R0 of about 2.5, as Abdul said, it's even higher in Washington State right now, and taking into account that only 5% of based on the Wuhan data, 5% of cases will need to be hospitalized, and 5% of those will need to be treated in the ICU. And also taking into account that it's about a 2-week stays, 13 days based on the Wuhan data, we will almost 300,000 ICU beds in one example of our simulation scenarios. And that will be at the peak of the outbreak, which we expect to occur, according to that scenario, in the next few months. And so I should maybe compare with, we have in this country 90,000 ICU beds, and about 60% are already occupied at any time for other diseases. And another point also to make is the spatial distribution of those beds. So when we're talking about we need 300,000 perhaps, that is across the country, but we have to think also about the spatial distribution of those beds. We might have a cluster of cases, and we might have availability of ICU beds in another location, but we have to think about how are we going to get the patients to the open ICU beds, or what strategies we're going to employ.
Okay, let me now go to some of the frontline folks who are here and ask them whether they think they and their colleagues are prepared in what they need. Dr. Dooley, what does your office and family practitioners all over this country need right now in order to be better prepared for this crisis?
Absolutely. We need more tests, and we need the availability. We need the right as physicians to determine who needs to be tested versus these very strict, stringent criteria that are going to miss a lot of people. So we need to be able to freely test patients we feel are most risk, and those are going to include people who don't have an obvious known source of exposure to someone with coronavirus. And we need masks. So we are not recommending that everyone in the general public wear masks. Again, if you are using all the masks and doctors and nurses run out and all the doctors and nurses get sick, there's nobody to take care of you when you're sick. And they've also done some studies with people who wear masks. They are less stringent about their hand hygiene. And hand hygiene is key. It is crucial. More important than the mask is your hand hygiene. And when you're wearing a mask, you're less likely to wash your hands. It's so shocking when I go out to the movie theater or the mall, the amount of people who just leave the bathroom without washing their hands or rinse their hands, don't wash their hands. You have to wash your hands, you have to lather, you have to get in between your fingers, and don't forget about the backs of your hands. You can't just wash the fronts of your hands. Your hands have two sides. So we need the ability to test more people. We need masks, and again, we need those hospital beds for when our patients get sick.
By the way, interestingly enough, correct me if I'm wrong, we need hand sanitizers that are affordable.
Absolutely, we need
And interesting, and I applaud the governor of New York State on this. Apparently, the hand sanitizer companies now see an opportunity to make a whole lot of money. They're raising their profits, their prices. In New York State, I think they're going to start producing this thing at the statewide level, which I think is exactly the right thing. Deborah, nurses are nervous, are they not?
They are concerned, they're not nervous, because we know if we have the proper equipment, we can take care of these patients safely. To that end, we have made 6 major demands of our employers, which is that they have plans and protocols in place using a precautionary principle, that they clearly communicate to other nurses and healthcare workers about their exposure to the COVID-19, possible exposure, that they provide education and training, and not the just-in-time training, but actual time where you can practice it. We've also asked that they provide functioning negative pressure rooms and personal protections for nurses, which right now are being kept under lock and key by managers, and the nurses have to go and get the key to get the masks, and have been told during a code, hold your breath. I mean, it's startling that these things are happening. Then also plan for a surge of patients. One of our nurses that took care of a COVID patient worked 80 hours in 1 week. That's obscene. And then also make sure that nurses and other healthcare workers that get put out on quarantine get pay, and that they actually put those patients, those healthcare workers, in quarantine. There was a nurse that was exposed, and they said she could work because she wasn't symptomatic. The cruise ship gets better quarantine than healthcare workers that are actually working with the virus. Then of our federal government, we have asked for the highest levels of protection. We want enforcement that is mandatory. Right now, the CDC guidelines, all of those recommendations are guidelines. They're not mandatory. So nurses can't, without the backing of the federal government and some state governments, actually make sure that they can enforce them. So they're merely suggestions which don't care for us. And we need more funding in an emergency spending package to get these public health systems up and running and functioning better than they are now.
Thanks. Greg, did you want to ask anything, add anything?
What this underscores is our reliance on China. So talking to large group purchasing organizations and CEOs of healthcare networks, a lot of these supplies come from China. You talk about generic drugs, you talk about the most basic thing, rubber comes from China, which is rubber gloves that all doctors have to use. So as these pandemics start to grow and in the future, we need to be able to start looking at our infrastructure within the United States and how we can look at making these things either here or with countries that are under free trade agreements that we agree with, so that we're not so reliant on another country, because as these pandemics spread, borders start shutting down, and that will be less and less prepared for doctors and other people like that on the front lines.
All right, I'm gonna have to go in a little while, but I wanted to open up if there were any questions that the media might have. Yeah, right here. 15,000. All right, that's a very good question, and it's something that we have thought about a lot. We do not hold a rally without first conferring with local public health officials. But your question obviously goes a lot more to a political rally than I may have. It goes to basketball games, it goes to theater events all across this country. And that is an issue, I think, that every organization, every sports team is going to have to look at. So to answer your very good question, it is an issue that we think about a whole lot. We do not go forward without consultation with local public health officials. Yeah, Cara. Well, I think as Dr. Dooley said, that's not so easy. She doesn't have masks for her office, but
those patients, so
Masks, so no, that would absolutely not be a good idea.
It wouldn't be a smart thing to do, right? Any additional mask that we find should be immediately rerouted into the health system, not be handed out, wantonly in a public space.
When masks aren't used properly, studies have looked at this with regard to flu transmission. It can actually exacerbate transmission because people end up touching their face a lot more to take their mask off and adjust their mask. So if they're used properly, they can be effective, but just the general public using masks could even be harmful.
I'm sorry, I can't hear that. Well, I'm surrounded by medical personnel. Thank you for asking. I'm running for president of the United States, and that requires a whole lot of work, but there we go. All right, okay. Well, obviously, everybody in any area of life in America is concerned about the coronavirus. If I'm a manufacturer, my work is going to come in. If I'm working in an office, what does that mean? So the answer, I think that every organization in America is taking a hard look at what the coronavirus will mean to their operations. And yes, that is true of our campaign as well. But I don't want to get today, really, if you'll forgive me, I don't want to get too much into politics. Today, what I wanted to do is talk about what happens when you bring some knowledgeable people together in terms of how we go forward to address this crisis. Yeah. Absolutely. Well,
I was growing up, we got the polio vaccine for free and nobody asked how you pay for it because what they saw were children in iron lungs that were going to be damaged forever. How insane and cruel is it to suggest that we have to figure out how to pay for it when we can actually go to war and not ask one question, but to prevent this kind of a disease, we have to say, how can we pay for it? I'm sorry.
Yeah, the cost of not paying for the vaccine is going to be orders of magnitude much more expensive.
Do I approve of spending a few cents for a vaccine rather than seeing people die or spending thousands of dollars on hospital care? Yeah, I kind of think it makes a little bit more sense to invest a few cents in a vaccine. Let me just say this again. And this deals with the pharmaceutical industry. It is a top priority. This is a no-brainer. That you would ask a question like that almost talks about one of the very serious problems facing this country. Does anybody in their right mind believe that if you're rich, you should be able to afford a vaccine and save your life, but if you're poor, you got to die? Is that really where we're at the United States of America? So obviously, we will make vaccines free to every man, woman, and child. I, of course, would take that proposition a lot further. There are people who are rationing insulin right now because we're paying 10 times more for insulin in this country than Canada. And I will tell the pharmaceutical industry, if you don't lower your prices to what other countries are paying, we will make generic drugs that are affordable to all people. Yeah, Bill.
One thing we have to remember here, the value of a vaccine isn't just in protecting the individual who gets the vaccine. It's in protecting literally everyone who they come in contact with. I bet you if you pulled all of those Fortune 500 CEOs whose stocks just took a tumble today and asked, hey, would you be willing to help fund that? I bet you they'd say, yeah, definitely.
Yeah, last question, yes. Well, obviously, I think the global economy is reeling right now. Supply chains are being threatened. Workers are not going to work. And this is going to impact economies all over the world. And I think this is obviously a difficult issue, but it would certainly help if the world and the people of our own country had confidence that the administration of the United States of America, that our government was making decisions based on science. And I do not mean to be disrespectful, but I'm telling you the truth, that if people of the world would like to know that we have a president who doesn't lie all of the time. And you know, when you have a president who's a pathological liar, that's one thing when you got to deal with that politically. It's another thing when you got to deal with it in the midst of a healthcare crisis. What is he saying that is true? What is he saying that is another lie? People don't have confidence. And that is a major, major concern. I apologize. We're going to have to get going. Thank you all very, very much. And let me thank the panelists for this excellent discussion. Okay, thank you all very much for being here. Let me begin by reiterating what I have said from day one of this campaign, and that is that Donald Trump is the most dangerous president in the modern history of our country, and he must be defeated. Tragically, we have a president today who is a pathological liar and who is running a corrupt administration. He clearly does not understand the Constitution of the United States and thinks that he is a president who is above the law. In my view, he is a racist, a sexist, a homophobe, a xenophobe, and a religious bigot, and he must be defeated, and I will do everything in my power to make that happen. Last night, obviously, was not a good night for our campaign from a delegate point of view. We lost in the largest state up for grabs yesterday, the state of Michigan. We lost in Mississippi, Missouri, and Idaho. On the other hand, we won in North Dakota, and we lead the vote count in the state of Washington, the second largest state, contested yesterday, with 67% of the votes having been counted. We are a few thousand votes on top. What became even more apparent yesterday is that while we are currently losing the delegate count, approximately 800 delegates for Joe Biden and 660 for us, we are strongly winning in two enormously important areas which will determine the future of our country. Poll after poll, including exit polls, show that a strong majority of the American people support our progressive agenda. The American people are deeply concerned about the grotesque level of income and wealth inequality in this country, and the American people want the wealthy and large profitable corporations to start paying their fair share of taxes. Overwhelming support for that. The American people understand that the federal minimum wage of $7.25 an hour is a starvation wage. They want to raise the minimum wage in this country to a living wage of at least $15 an hour. And the American people understand that if our kids are going to make it into the middle class of this country, we must make public colleges and universities and trade schools tuition free. The American people understand that we cannot continue a cruel and dysfunctional healthcare system. And it is amazing to me to see that even in conservative states like Mississippi, there is an overwhelming understanding that we are now spending twice as much per capita on healthcare as do the people of any other country, while 87 million of us remain uninsured or underinsured. And this crisis, this absurd healthcare system, is becoming more and more obvious to the American people as we face the challenge of the coronavirus pandemic that we are currently experiencing. Imagine facing a pandemic and having 87 million people who are having a difficult time going to a doctor when they need. And the American people know, unlike Donald Trump, that climate change is an existential threat to our country and the planet, and that we need to transform our energy system away from fossil fuel to energy efficiency and sustainable energy. And the American people also know that we need fundamental transformation of a broken and racist criminal justice system, as well as a cruel immigration system that keeps millions of people living in fear. But it is not just the ideological debate that our progressive movement is winning. We are winning the generational debate. While Joe Biden continues to do very well with older Americans, especially those people over 65, our campaign continues to win the vast majority of the votes of younger people. And I am talking about people not just in their 20s, but in their 30s and their 40s. The younger generations of this country continue in very strong numbers to support our campaign. Today, I say to the Democratic establishment, in order to win in the future, you need to win the voters who represent the future of our country, and you must speak to the issues of concern to them. You cannot simply be satisfied by winning the votes of people who are older. While our campaign has won the ideological debate, we are losing the debate over electability. I cannot tell you how many people our campaign has spoken to who have said, and I quote, I like what your campaign stands for. I agree with what your campaign stands for. But I'm going to vote for Joe Biden because I think Joe is the best candidate to defeat Donald Trump. End of quote. We have heard that statement all over this country. Needless to say, I strongly disagree with that assertion. But that is what millions of Democrats and independents today believe. On Sunday, I very much look forward to the debate in Arizona with my friend Joe Biden. And let me be very frank as to the questions that I will be asking Joe. Joe, what are you going to do for the 500,000 people who go bankrupt in our country because of medically related debt? And what are you going to do for the working people of this country and small business people who are paying on average 20% of their incomes for healthcare? Joe, what are you going to do to end the absurdity of the United States of America being the only major country on earth where healthcare is not a human right? Are you really going to veto a Medicare for all bill if it is passed in Congress? Joe, how are you going to respond to the scientists who tell us we have 7 or 8 years remaining to transform our energy system before irreparable harm takes place to this planet because of the ravages of climate change? Joe, at a time when most young people need a higher education to make it into the middle class, what are you going to do to make sure that all of our people can go to college or trade school regardless of their income? And what are you going to do about the millions of people who are struggling with outrageous levels of student debt? Joe, at a time when we have more people in jail than communist China, a nation 4 times our size, what are you going to do to end mass incarceration and a racist criminal justice system? And what are you going to do to end the terror that millions of undocumented people experience right now because of our broken and inhumane immigration system? Joe, what are you going to do about the fact that we have the highest rate of childhood poverty of almost any major country on earth, and are living with the fact that 500,000 people tonight are homeless and 18 million families are spending half of their income to put a roof over their heads? Joe, importantly, what are you going to do to end the absurdity of billionaires buying elections and the 3 wealthiest people in America owning more wealth than the bottom half of our people? So let me conclude the way I began. Donald Trump must be defeated, and I will do everything in my power to make that happen. On Sunday night, in the first one-on-one debate of this campaign, the American people will have the opportunity to see which candidate is best positioned to accomplish that goal. Thank you all very much. In the last few days, we have seen the crisis of the coronavirus continue to grow exponentially here in the United States and around the world. And we have witnessed a global economic meltdown which will impact millions of workers in our own country. In terms of potential deaths, and in terms of the economic impact on our economy, the crisis we face from the coronavirus is on a scale of a major war, and we must act accordingly. Nobody knows what the number of fatalities may end up being, or the number of people who may get ill, and we all hope that that number will be as low as possible. But we also have to face the truth, and that is that the number of casualties may actually be even higher than what the armed forces experienced in World War II. In other words, We have a major, major crisis, and we must act accordingly. Therefore, it is an absolute moral imperative that our response as a government, as a society, as a business community, and as individual citizens meet the enormity of this crisis. As people stay or work from home and are directed to quarantine, it will be easy for us to feel like we are all alone. I'm working at home, not in my office. Or that we must only worry about ourselves and think that everybody else should fend for themselves. But in my view, that would be a tragic and dangerous mistake. If there ever was a time in the modern history of our country when we are all in this together, this is that moment. Now is the time for solidarity. Now is the time to come together with love and compassion for all, including the most vulnerable people in our society who will face this pandemic from a health perspective or face it from an economic perspective. If our neighbor or coworker gets sick, we have the potential to become sick. If our neighbor loses his or her job, then our local community suffers and we may lose our jobs. We are in this together. If doctors and nurses and medical personnel do not have the equipment and the training and the capacity they need right now, people we know may unnecessarily face additional illness and even death. We are all in this together. Unfortunately, in this time of international crisis, it is clear to me, at least, that we have an administration that is largely incompetent and whose incompetence and recklessness have threatened the lives of many, many people in our country. So today I would like to give a brief overview of what, in my view, we must do to respond to this crisis. First and foremost, we are dealing with a national emergency, and the President of the United States must understand that and declare that emergency. Next, because President Trump is unwilling and unable to lead selflessly, we must immediately convene an emergency bipartisan authority of experts to support and direct a response that is comprehensive, compassionate, and based first and foremost on science and fact. In other words, Congress, in a bipartisan manner, must take responsibility for addressing this unparalleled crisis. Further, we must aggressively make certain that the public sector and the private sector are strongly cooperating with each other, and we need national and state hotlines staffed with well-trained people who have the best information available. One of the aspects of the current crisis is there are people who are asking themselves, what are the symptoms of coronavirus? Do I have a cold? Do I have the flu? Do I have the coronavirus? Who's going to help me? Where do I go to seek medical treatment? How do I get a test? When is that test going to be processed? People have a lot of questions. And at the statewide and federal level, we need experts to provide the necessary information to our people. The American people deserve transparency, something that the current administration has fought day after day to stifle. In other words, we need to know what is happening right now in our country, in our states, and in fact, all over the world. if there was ever a time for transparency and honesty and being straightforward, this is that moment. And we need that information coming from credible, respected, scientific voices, of which we have many in our own country and all over this world, not from politicians. And during a crisis, we must make sure that we care for the communities most vulnerable to the health and economic pain that is coming. Those in nursing homes and rehabilitation facilities, those confined in immigration detention centers, those who are currently incarcerated and in jails, and all people regardless of their immigration status. Unfortunately, as I think the American people increasingly understand, our country is at a severe disadvantage compared to every other major country on earth because we do not guarantee health care to all people as a right. And as we speak, some 87 million Americans are either uninsured or underinsured. And when you are uninsured or underinsured, you hesitate about getting the medical care you need because you cannot afford to get that medical care. The result is that millions of our people cannot afford to go to a doctor, let alone pay for a coronavirus test. So, while we work to pass a Medicare for all single-payer system, the United States government today must make it clear that in the midst of this emergency, everyone in our country, regardless of income or where they live, must be able to get all of the health care they need without cost. Obviously, when a vaccine or other effective treatment is developed, it must be free of charge. We cannot live in a nation where if you have the money, you get the treatment you need to survive, but if you're working class or poor, you get to the end of the line. That would be morally unacceptable. Further, we need emergency funding right now for paid family and medical leave. Anyone who is sick should be able to stay home during this emergency and receive their paycheck. What we do not want to see is at a time when half of our people are living paycheck to paycheck, when they need to go to work in order to take care of their family. We do not want to see people going to work who are sick and who can spread the coronavirus. We also need an immediate expansion of community health centers in this country so that every American will have access to a nearby healthcare facility. Where do I go? How do I get a test? How do I get the results of that test? Need greatly to expand our primary healthcare capabilities in this country, and that includes expanding community health centers. We need to determine the status of our testing and processing for the coronavirus. The government must respond aggressively to make certain that we, in fact, have the latest and most effective tests available and the quickest means of processing those tests. There are other countries around the world who are doing better than we are in that regard. We should be learning from them. None of the medical experts that I have talked to dispute that there is a major shortage of ICU units and ventilators that are needed to respond to this crisis. The federal government must work aggressively with the private sector to make sure that this equipment is available to hospitals and the rest of the medical community. Our current healthcare system does not have the doctors and nurses we currently need. We are understaffed. During this crisis, we need to mobilize medical residents, retired medical professionals, and other medical personnel to help us deal with this crisis. We need to make sure that doctors, nurses, and medical professionals have the instructions and personal protective equipment that they need. This is not only because we care about the well-being of medical professionals, but if they go down, then our capability to respond to this crisis is significantly diminished. The pharmaceutical industry must be told in no uncertain terms that the medicines that they manufacture for this crisis will be sold at cost. This is not the time for price gouging or profiteering. The coronavirus is already causing a global economic meltdown, which is impacting people throughout the world and in our own country. And it is especially dangerous for low-income and working-class families, people who today, before the crisis, are struggling economically. Instead of providing more tax breaks to the top 1% and large corporations, we need to provide economic assistance to the elderly, and I worry very much about elderly people in this country today, many of whom are isolated, many of whom do not have a lot of money. We need to worry about those who are already sick. We need to worry about working families with children, people with disabilities, the homeless, and all those who are vulnerable. We need to provide, in that context, emergency unemployment assistance to anyone in this country who loses their job through no fault of their own. Right now, 23% of those who are eligible to receive unemployment compensation do not receive it. Under our proposal, everyone who loses a job must qualify for unemployment compensation at least 100% of their prior salary, with a cap of $1,150 a week or $60,000 a year. In addition, those who depend on tips, and the restaurant industry is suffering very much from the meltdown, those who depend on tips, gig workers, domestic workers, and independent contractors must also qualify for unemployment insurance to make up for the income that they lose during this crisis. We need to make sure that the elderly, people with disabilities, and families with children have access to nutritious food. That means expanding the Meals on Wheels program. It means expanding the school lunch program and SNAP so that no one goes hungry during this crisis, and everyone who cannot leave their home can receive nutritious meals delivered directly to where they live. We need also, in this economic crisis, to place an immediate moratorium on evictions, on foreclosures, and on utility shutoffs, so that no one loses their home during this crisis, and that everyone has access to clean water, electricity, heat, and air conditioning. We need to construct emergency homeless shelters to make sure that the homeless, survivors of domestic violence, and college students quarantined off campus are able to receive the shelter, the health care, and the nutrition they need. We need to provide emergency lending to small and medium-sized businesses to cover payroll, new construction of manufacturing facilities, and production of emergency supplies such as masks and ventilators, a very serious problem right now in the midst of this crisis. Here is the bottom line, and that bottom line is that in the midst of this unprecedented moment, we need to listen to the scientists, to the researchers, to the medical folks, not to politicians. We need an emergency response to the current emergency, and we need it immediately. We need more doctors and nurses in underserved areas. We need to make sure that workers who lose their jobs in this crisis receive the unemployment assistance they need. And in this moment, we need to make sure that in the future, after this crisis is behind us, we build a healthcare system that makes sure that every person in this country is guaranteed the healthcare that they need. Thank you all very much. As I discussed yesterday, our country is facing, as everybody knows, a medical and economic crisis, the likes of which we have not seen for generations. And we must prepare for this response in an unprecedented way, making certain that our government responds effectively and protects the interest of all of our people, regardless of their income or where they live. In other words, this is not just about giving tax breaks to large corporations, but it is about remembering the people today who do not have much money, who are very nervous about their economic futures and about their healthcare prospects. Needless to say, we must massively increase the availability of test kits for the coronavirus and the speed in which those tests are processed. We need to anticipate significant increases in hospital admissions, which means that we will need more ICU units and ventilators. We will need more doctors, more nurses, and medical personnel of all kinds. And we must make sure that these frontline personnel are well protected from the diseases they are treating. I have talked to nurses recently who worry very much about whether they're getting the kind of knowledge they need and the equipment they need to make sure that they do not get sick. We need to significantly improve our communications and collaboration with other countries to assure that we are learning everything that we can about the successes and failures other countries are encountering as they deal with this crisis. And furthermore, we must be honest with the American people and communicate as effectively and directly as we can with all of the scientific information that we can provide. Further, and perhaps most importantly, our response to this entire crisis must be guided by the decisions of doctors, scientists, and researchers, not politicians. But as we struggle with this crisis, it is also important that we learn the lessons of how we got to where we are today and what we must do in the future so that we are better prepared for similar crises that may come. Poll after poll already shows us that the American people understand that we must do what every other major country on earth does, and that is to guarantee health care to all of our people as a human right, not a privilege. As we begin to see the failures and vulnerabilities of the current healthcare system, my guess is that those numbers and the demand for universal health care will only go up. The American people are asking, how is it possible that we spend twice as much per capita as the people of Canada and other major countries, while 87 million of us are uninsured or underinsured? And obviously, in this crisis, and unbelievably, it means that people who are sick today, people who woke up this morning with symptoms of the coronavirus, are saying, you know, I feel sick, but I can't afford to go to a doctor. And when somebody is not treated for the virus, somebody who is unable to afford to go to that doctor, that means that that infection can spread to many others, putting us at risk. So it is not just a question that in normal times, tragically, unbelievably, we lose some 30,000 people a year because they don't get to a doctor on time. But now the lack of health insurance for many millions of people threatens other people as well. How could it be that when we spend so much more than what other countries are spending, we have millions of people who may be dealing with the virus but who cannot go to a doctor because they cannot afford it. That is a question that must resonate in every American's mind. If this isn't a red flag for the current dysfunctional and wasteful healthcare system, frankly, I don't know what is. For the benefit of all of us, we must make sure that every person in this country who needs to seek medical treatment can go to a doctor free of charge, regardless of their income. That is obviously what we must do now in the middle of the crisis, but that is what we must do as a nation in the near future. And here are just a few instances about how absurd and dysfunctional our current healthcare system is. It has been estimated that a full battery of tests for the coronavirus cost over $1,300. So first of all, take a look at that. $1,300 to get the test people need to have to know whether they have the virus or not. In America today, 40% of our people don't have $400 in the bank to pay for an emergency expense. We have half our people living paycheck to paycheck. If their car breaks down, they can't afford to get it fixed. And if somebody tells them it's going to cost $1,300 for the test that you need to determine whether you have the coronavirus, what are they supposed to do? What are they supposed to do? What happens to them? Maybe they end up going to a payday lender where they can pay 50 or 100% interest rates on borrowing the money that they need. Do they borrow money from their families, or do they go without a test, which every doctor in the world will tell them is a test they should have? And while the Trump administration says it may cover copays to cover the cost of testing for those who have insurance, they will not cover the cost of treatment, which could cost tens of thousands of dollars. How cruel is that? How absurd is that? To say to people, well, we're sorry you have the coronavirus. We actually covered the cost of the test, but now you're on your own. And it's going to cost you tens of thousands of dollars to get treated. That is totally absurd. If clearly what we need to do is to make sure that if somebody has the coronavirus, that person gets the treatment they need. In other words, we have a healthcare system today which leaves millions of people uninsured. But even if you have insurance, you may not have the ability to travel to a doctor near you, because now we're talking about a system in which many rural hospitals have closed down and people cannot find a doctor in their communities. The reality today, and this is an issue we must deal with, is that we do not have enough doctors, we don't have enough hospitals, we don't have enough clinics in rural communities and in inner cities. Further, we are in a situation when we desperately need affordable prescription drugs. Yet we have a pharmaceutical industry that continues to make billions in profits by charging outrageous prices for prescription drugs, sometimes 10 times more in this country than in other countries. In my view, the most cost-effective way to reform our dysfunctional and cruel system is to move to a Medicare for all, single-payer healthcare system. And I think in the midst of this crisis, more and more Americans understand the truth of that. It is nearly impossible to believe that anyone can still think it's acceptable to continue with a healthcare system that leaves tens of millions of people uninsured. The cruelty and absurdity of that view is more obvious in the midst of this crisis than it has ever been. And let's be clear, the lack of health care and affordable medicine does not only threaten the health care and well-being of the uninsured, it impacts everyone who comes in contact with them. In fact, what this crisis is beginning to teach us is that we are only as safe as the least insured person in America. Further, we are the only major country on earth, that does not mandate paid family and medical leave. And we're seeing how that crisis is impacting where we are today. As we speak, there are millions of workers right now who are being told not to go to work yet that they may be ill and should be staying home. But these very same families will face financial ruin if they don't go to work. These are workers in the restaurant industry, transportation industry, tourism, retail. In other words, the people who interact with the public every single day. Right now, at a time when half of our people live paycheck to paycheck, and at a time of massive wealth and income inequality, we must directly address the economic desperation facing a huge number of Americans. So, we must finally pass a paid family leave program in the United States to keep this virus from spreading and to keep Americans healthy. We must do it right now. People should not be going to work when they are sick. It is unfair to them. It is unfair to the people they are in contact with. And yet, that reality exists because we're the only major country on earth not to guarantee paid family and medical leave and sick time. Finally, from a national security perspective, it is incomprehensible that we are dependent on China and other countries for masks, for prescription drugs, for rubber gloves, and for key parts needed to make advanced medical equipment like ventilators. As a result of globalization and our disastrous trade policies, we have been outsourcing millions of jobs and factories overseas that have gutted our economy. Now we are seeing another tragic and devastating result of those policies as we find ourselves dependent on other countries to provide the most essential things we need to combat a pandemic and protect the lives of the people in our country. Now, trade is a good thing, but it has to be based on common sense principles. It has to be based on protecting American workers and protecting our national security, making sure that we are producing what we need in this country in the event of a national crisis. Now is the time to begin bringing back production and manufacturing to the United States and enact fair trade policies so that we are never in this position again. Now, here is the bottom line. As we are dealing with this crisis, we need to listen to the scientists, to the researchers, and to the medical professionals, not politicians. We need to move quickly to prepare for the exponential increase of cases we will be seeing here in our country. But as we do that, we must begin thinking about how, as a society, we can create a healthcare and economic system that is humane, that is compassionate, and that works for all people, not just the wealthiest. Now, that is an issue that people have been thinking about for a long time, but I think in this moment of crisis, more and more people understand that we need fundamental changes to our economy. We need fundamental changes to our healthcare system. I'd be happy to take a few questions. Yeah, Gary? That's a tough question, and I'll tell you why. Elections are the bedrock of our democracy, and we don't want to be, delaying elections on a willy-nilly basis. On the other hand, if my memory is correct, in states like Ohio and in many other states, schools are being closed down. The NBA has ceased its season. Broadway is now shut down. So there is obviously a growing concern about bringing people together and spreading the virus. So I think the answer to your good question is this is an issue where the doctors and the scientists and the public health officials are going to have to be weighing the risk. I don't think there's anybody out there, no matter what your political view may be, who wants to see people become infected because they are voting. So that's a decision that I hope the public officials in the various states will consult with their public health people and their doctors to make that decision. Yeah, yes. Yeah.
Obviously, the way that the coronavirus has affected the campaign in terms of having to cancel events, telling
Right.
your staff to work from home,
Yeah.
especially at a time, when you really needed to be making your case with as many people as possible. How are you feeling about how this is affecting your campaign?
That's why I'm here today. You're right, it has significantly impacted our campaign, as all of you know. We do, I think, more rallies than anybody else. They're often very well attended. I love to do them. We have done dozens of town meetings throughout this campaign, which I love also because you can hear directly from people, and that is changing. As you've indicated correctly, our staff is now by and large working at home. So it has radically changed our campaign. What I think we have going for us, which we have always had going for us, but we're going to have to utilize even more, is our internet capabilities. We have many millions of people who follow us on Twitter, follow us on other platforms. We live stream, everything that we do. I think we're probably live streaming this, and many hundreds of thousands of people will be watching. So we are in the process of thinking this through, but this coronavirus has obviously impacted our ability to communicate with people in the traditional way that we do, and that's hurting. Yeah, sure. No, I have not. Thank God I don't have any of the symptoms. To the best of my knowledge, I have not interacted with anybody who has the virus. So, in a time when people are desperately trying to get into the testing, I don't want to put myself in front of anybody else. So, that's that. Here is my concern. Traditionally, especially under Republican administrations, the response to crises, economic crises, has often been to protect the wealthy and large corporations, and I would refer you to the Wall Street bailout and tax breaks we have recently seen for billionaires and for large profitable corporations. My concern is that in the midst of this crisis, we pay attention to the most vulnerable people in this country. I was in New York City the other day to do the Jimmy Fallon show, and we were traveling around rush hour. And you know what? There wasn't a rush. A lot of people were not on the roads. I talked to drivers. They're not getting the business they used to. Restaurants are not getting the businesses. Conventions are being canceled. The tourism business is in downfall right now. Let us not forget today those workers who are being impacted by this crisis, and let us develop policies that speak to their needs. That means extending and expanding unemployment benefits, dealing with paid family leave and sick time and medical leave. So let us focus on working families, and I have my doubts about how effectively the Trump administration will do that. Yeah.
And Senator, you're going to go back to Washington now. You have an opportunity now to work with your colleagues to come up with solutions to this problem. Obviously, there's already proposals that are being discussed. What can you specifically do as a United States Senator to help address this crisis? Do you have legislation that you're considering proposing or something along those lines?
Good question. We're going to be working with our colleagues to do exactly what I just said in response to Shaq's question. I think, and most Americans understand, that it is totally insane that in the richest country on earth, we are the only major country not to guarantee paid family and medical leave. You have, on top of that, people who are having jobs in this country who have no vacation time or maybe 1 week vacation time. I think now is the time to make sure that every American has the paid family and medical leave that exists in other countries around the world. That is something we'll be fighting for. Unemployment compensation. Right now, there are many people who are not covered by unemployment at all, and we want to make sure that every American who loses his or her job gets covered by that program. And needless to say, right now, we must guarantee health care to every single American at no cost to them, and as we move to a Medicare for all system. So to answer your question, what the focus, I will be working with my colleagues. My focus will be on protecting the working class and the most vulnerable people in this country, including many elderly people. I'm sitting here wondering, I know that in my state, this state, and in states all over this country, the Meals on Wheels program, which is such an important program, often has long waiting lines. Now, what happens if you're an elderly person right now and you are told you are the most vulnerable population? You can't get out of the house, don't go out of your house, don't go shopping. What happens to those people? Is anybody paying attention to them? Is anybody visiting with them? So those are some of the areas that we'll be working. Yes, sir.
President criticized the cost of Medicare for all, and now he's saying in the midst of this outbreak that the country needs to spend whatever it takes.
The answer is, not frustrating. I wouldn't use that word. What I would say is that right now, the absurdity and the dysfunctionality of the current healthcare system is becoming apparent to everybody. And maybe this is an issue that Joe Biden and I will be discussing on Sunday night. But the idea that people are now saying, well, we should spend as much as it takes, when in fact, in normal times, we are spending twice as much per capita on healthcare as any other people, while the healthcare industry made $100 billion last year in profits, and the pharmaceutical industry makes huge profits as well. So as I said earlier, I think maybe for Mr. Biden, maybe for other people, this is the time to think about our current healthcare system and how does it happen that after we spend so much, so many of us are uninsured or underinsured. Is the function of healthcare just to make huge profits for the insurance industry and the drug companies, or should it be to provide quality care to all? And it's not even just the uninsured and underinsured. It's parts of this country, as you all know, in rural America, where hospitals have shut down. What do you do in this emergency? You have no medical care near you. What do you do when there aren't enough doctors, or there aren't enough nurses? How does that happen? So I would hope that this crisis, maybe that's my main point today, that this crisis should be a moment in which people ask fundamental questions about the dysfunctionality of our current healthcare system and have the guts to finally say to the healthcare industry, the drug companies, the insurance companies, and others, that the function of a rational healthcare system is to provide quality care to all, not to make billions in profits for the people who own the industry. Yeah, Karen?
Find themselves under, they can't go to work, they have to watch their children. Seems like it would then be hard to expect them to come out and vote during these primaries. So just to follow up on Gary's question, I'm wondering if anyone from your team has reached out to the DNC, or the DNC has reached out to you to talk about this.
That's a good point. I mean, you're raising, that's an additional point to the one that I made. I think we are told right now that we should stay away from other people, that we don't want to see the virus being spread. And in state after state, schools are being shut down. Large functions are being shut down. But your point is an additional point, which I think is right. If in states right now, and this is just an issue we have to deal with in so many ways, if child care centers are being shut down, and they are, if schools are being shut down, and they are, what are parents supposed to do? What do? Well, they're going to have to stay home and take care of the kids. Can you go out and vote when you're staying home taking care of your little kids? The answer is you can't. So all I would say is I think that the governors and the officials in the states that are that have elections scheduled for Tuesday have to balance things. Again, rescheduling elections is not something we do lightly or should do lightly. On the other hand, at this particular moment, it is absolutely appropriate that public officials, governors, etc., listen to public health officials. And your point is also important, to make sure that everybody who wants to vote has the right to vote. And that may not be the case today. Okay. Yeah, we have talked to the DNC about this. Yes.
There have been some reports that President Trump has been in close proximity with people who have tested positive for the coronavirus. Would you suggest the president get tested himself and release those results?
I would. I was asked early on, to the best of my knowledge, I have not been in proximity to somebody who had the virus. If I knew that I was, I would get tested, and I think that holds true for the president. And I think as president, he has the right to release that information. Okay, guys? Yeah.
I wonder, I know that the dynamics of your campaign itself have changed a lot because of what's happened with coronavirus. And there's obviously some within the Democratic Party that are concerned that you might be staying in the race for too long. Has that rethought, have you been forced to rethink your position in the race? And you know, what is your long-term goal as you move forward?
Well, my long-term goal is to win. The short-term goal is to figure out how we deal with the issues that you guys are appropriately raising. Under normal circumstances, I would not be in Burlington today. I would be probably in Ohio, Florida, or another state where a primary is coming up. But we've decided not to do, under the advice of public health officials, not to do rallies, and that's the right decision. So we are figuring out a way as to how we can best communicate with people, which will, certainly be in a very strong way utilizing our social media capabilities. I don't have to tell anyone viewing this program that our country, and in fact the world, are facing an unprecedented series of crises. We're dealing with the coronavirus, which is spreading throughout this country and throughout the world. We're dealing with a growing economic meltdown, which will impact tens of millions of workers in this country. We're dealing with a political crisis as well. And I think the main point to be made tonight is that in this moment of crisis, it is imperative that we stand together, understand that right now, throughout this country, there are so many of our people who are wondering what is going to happen to me tomorrow. In my own city, Burlington, Vermont, bars have been shut down, restaurants shut down, child care centers shut down, schools shut down. What happens to all the people who lose their jobs? What happens to people who tonight are worried that they may have the coronavirus but don't have the resources to get the tests they need or the treatment that they need? So this is a moment that we have got to be working together and going forward together. And what I wanted to do tonight, along with you, is to talk about a series of proposals that we are working on right now, and I will introduce to the Democratic leadership as to how we can best go forward. In this unprecedented moment, this will require an unprecedented amount of money, and my own guess is that we'll be spending at least $2 trillion in funding to prevent deaths, job losses, and to avoid an economic catastrophe. So let me just go over some of the issues, and we'll be posting these ideas tomorrow up on our website, berniesanders.com. This is what I would like, because we certainly don't know it all. We want to hear from you, not only your ideas about how we can best go forward, talk about your experiences. In every state, there is a different level of crisis. In every occupation, there is a different level of concern. So please communicate with us so we can get the best understanding possible about what's going on in our country and how together we can come up with some effective remedies. Let me start off with the basics. And that is obviously from my perspective, and I know from all of your perspectives, we need to make certain that everybody in our country who needs to go to a doctor can get the health care they need regardless of their income. This is kind of a no-brainer, something that should have happened in our country many, many years ago. But in the midst of this crisis, what I believe we must do is empower Medicare to cover all medical bills during this emergency. Now, this is not Medicare for all. We can't pass that right now. But what this does say is that if you're uninsured, if you are underinsured, if you have high deductibles, if you have high copayments, if you have out-of-pocket expenses, Medicare will cover those expenses so that everybody, regardless of their health care needs, and I'm not just talking about the coronavirus, but their health care needs in the midst of this crisis will get all the health care that they need. That is what we should be doing in this moment of crisis. We need to make sure, furthermore, that as we go forward, we are effectively prepared to deal with the healthcare crisis that we're facing. And that means that we need to make sure that the hospitals have all of the ICU units and the ventilators that are needed to respond to this crisis. What the fear is, as you know, is that there will be a surge of patients coming into the hospitals and that we will not have the equipment that we need to deal with that crisis. Now, in my view, frankly, it is incomprehensible why in the wealthiest country on earth we are not better prepared, but be that as it may, in my view, right now, the federal government must work aggressively with the private sector to make certain that this equipment is available to hospitals and the rest of the medical community. In other words, federal government must take the responsibility of working with the private sector and saying, you know what, this is a major priority, you're going to get the job done. And during this crisis, in addition, of course, we need to mobilize medical residents, people in medical school, retired medical professionals, and other medical personnel to help us deal with this crisis. One of the great fears that we are facing right now is that doctors themselves and nurses themselves will become ill. And if our frontline defense in the medical profession is injured, is made sick, is not able to treat the American people, that's only going to make a very difficult situation even worse. Furthermore, and again, this goes without saying, it's something that should have been done. It has to be done immediately. We must massively increase the availability of test kits for coronavirus and the speed at which the tests are processed. We must look to successful coronavirus testing models in other countries and throughout our own country and implement best practices here. And right now, there are communities and states all over this country that do not have the test kits. It's taking too long to get the results. We've got to aggressively address that. In my view, we need to use existing emergency authority under the Defense Production Act to dramatically scale up production in the United States of critical supplies such as masks, ventilators, and protective equipment that our healthcare workers need. It is, again, quite unbelievable, but we have a short supply of masks, and if the doctors and nurses don't have the masks that they need, it's going to be very difficult for them to provide the care that patients require. We need to utilize the National Guard, the Army Corps of Engineers, and other military resources to deal with this crisis. Today, our armed forces must be immediately activated to build mobile hospitals and testing facilities, assist providers, reopen hospitals that have been shut down, and expand our healthcare capacity in underserved areas. One of the ongoing crises that our healthcare system faces. Many parts of this country, under the best of times, people can't find a doctor or a hospital is 200 miles away from them. That's not acceptable. We have to address that reality in the midst of this crisis today. We need to dramatically expand community health centers, which provide primary care, dental care, and mental health care, as well as low-cost prescription drugs to nearly 30 million Americans, including some of the poorest and most vulnerable. We have a primary healthcare system which is in very, very bad shape. Even people who have insurance having a hard time in many cases finding the doctors that they need. So expanding community health centers will be a significant step forward in making sure there are locations where people can get the testing they need, get the treatment that they need, get the health care that they need in general. And while we are making sure that all of our people have the health care that they need, we must also respond to the growing economic crisis that this pandemic is causing. That means that we must make sure that everyone who has a job right now receives the paychecks that they need and does not lose their income. I mean, as we speak right now, think about the millions of workers who are being laid off in the tourism industry, in the fast food industry, in the restaurant industry, in the transportation industry. These are folks that don't have a lot of money, as all of you know. Some 40% of the people in this country cannot afford a $400 emergency. So people are sitting out there and they're saying, my God, what am I going to do? How do I take care of my families? And that has got to be the major economic priority that we address. How do we take care of the working families of this country who are negatively impacted by this crisis? Small and medium-sized businesses, especially those in severely impacted industries such as restaurants, bars, and local retail, need immediate relief. We must tell these businesses who are being forced to lay off, in some cases, their entire staff, or possibly even shut down through no fault of their own, that we will not allow them to go out of business. The federal government will work with affected businesses to provide direct payroll costs for small and medium-sized businesses to keep workers employed until this crisis has passed. In other words, bottom line here, most important point is workers need to continue to get a paycheck even when their businesses are shut down. Further, we need to provide a direct emergency $2,000 cash payment to every household in America every month for the duration of the crisis to provide them with the assistance they need to pay their bills and take care of their families. Now, we're throwing out a lot of ideas. And when you deal with the United States Congress, you don't get everything that you want. There will be picking and choosing here and there. But I think it's important for us tonight to discuss the various options that they have. And one of those options is to make sure that people at least get a $2,000 a month check to take care of their basic needs. And importantly, we must make certain that the government is getting this money into the hands of working families and the most vulnerable as quickly as possible. In other words, we don't want some kind of bureaucratic arrangement where we're talking about this for weeks and months and people do not get the help that they need. We must provide emergency unemployment assistance to anyone who loses their job through no fault of their own. Under the proposal that I am working on, everyone who loses a job must qualify for unemployment compensation at 100% of their prior salary with a cap of $75,000 a year. In addition, those who depend on tips, waiters and waitresses and others, gig workers, domestic workers, freelancers, and independent contractors must also qualify for unemployment insurance to make up for the income that they lose during this crisis. And I think, as many of you know, unemployment compensation does not cover every worker in America. There are millions of people exempt from unemployment. We have got to deal with that right now. It doesn't matter what work you're doing. You lose your job, you need unemployment. Further, we need to make certain that seniors, people with disabilities, and families with children have access to decent quality food. That means expanding the Meals on Wheels program, the school meals program, and food stamps so that no one goes hungry during this crisis and everyone who cannot leave their home can receive nutritious meals delivered directly to where they live. In other words, that's as basic as you can get. In America during this crisis, people must not go hungry. We must place an immediate moratorium on evictions, on foreclosures, and utility shutoffs, and suspend payment on mortgage loans for primary residences and utility bills. In other words, it would be unacceptable that people could lose their homes, lose their apartments, see electricity or gas shutoffs during this crisis. So there must be a moratorium on all of those in those areas. Furthermore, we must restore utility services to any customers who have had the utilities shut off. Unbelievably, in America right now, you got a whole lot of folks who literally do not have running water in their homes because they haven't been able to pay their water bill. They may not have electricity, and that has got to be dealt with right now. We must also provide funding for states and localities to provide rental assistance for the duration of this crisis. In addition, we need to waive all student loan payments for the duration of the emergency. Long term, as I think all of you know, it is my view that we must cancel all student debt and make public colleges and universities and trade schools tuition free. And that is the view that I have held for a long time. But right now, at the very least, we must make sure that nobody is obliged to pay their student loan right now. Furthermore, we must ensure that the homeless, survivors of domestic violence, and college students quarantined off campus are able to receive the shelter, the health care, and the nutrition they need, and connect those individuals with social services to ensure nobody is left behind. We must also utilize empty hotel beds and other vacant properties to ensure that everyone in this country is safely housed during this crisis. We cannot forget that right now, tonight, there are some 500,000 people who are homeless, some in emergency shelters, some who are sleeping out on the street. Our job is to make sure that everyone is safely housed during this crisis. Further, we must protect farmers by suspending all Farm Service Agency loan payments to protect farmers during this crisis, extend crop insurance and emergency loans to all affected farmers, extend rural development loans, and expand the emergency food assistance program to help alleviate hunger throughout the country and support our farmers during this crisis. We already have a major crisis in terms of family-based agriculture in America. Thousands and thousands of family farmers are losing their farms. We've got to stop that process right now during this emergency. Finally, we must make sure that our response to this health and economic crisis is not another money-making opportunity for corporate America and for Wall Street. Let me underline that. We must make certain that this health and economic crisis is not another money-making opportunity for corporate America and for Wall Street. We need to establish an oversight agency to ensure that no one is profiting off of the economic pain and suffering of our people in the midst of this crisis. Any emergency credit extensions or loans to insolvent companies or industries as a result of this crisis must come with strict protections and benefits for workers, for unions, and for customers, not no strings attached handouts for large corporations and their executives. During this crisis, we will ban stock buybacks and bonuses for executives. We will put conditions on this financial assistance to make certain that any corporation in America that benefits from emergency aid does not lay off workers, pays workers a livable wage, and does not rip off consumers. We must make sure that companies that get bailouts are required to sell equity to the government and put workers on their board of directors. We need to prevent price gouging by pharmaceutical companies. As soon as a coronavirus vaccine is developed, it must be sold for free. This is not an opportunity for some drug companies to make a fortune by charging an outrageous price for the medicine that people need in order to stay alive. Further, all prescription drugs that are developed with taxpayer dollars must be sold at a reasonable price. The pharmaceutical industry must be told in no uncertain terms that the medicines that they manufacture for this crisis will be sold at cost. This is not the time for profiteering or price gouging. So, we've covered a lot of territory tonight, and this is what I would very much appreciate, where I'd appreciate getting your help. Once again, this is an outline of proposals that I will be introducing to the Senate leadership and working with the Democratic leadership to implement. But it is important for me to hear your comments. We will have this outline up tomorrow in a little bit clearer way on our website, berniesanders.com. And in addition to that, we need to know what you are experiencing right now. It's hard to write proper legislation if we are not familiar with the kinds of pain and problems that people all across this country are facing. So let me just conclude by once again thanking all of you for being with us tonight, to understand that what this country is experiencing right now is something that we have never experienced in the modern history of this country. That is, number one, a major pandemic, which threatens the health and lives of millions of our people. And on top of that, an economic crisis, which threatens the jobs and the income of many, many, many millions of people. So we got some major crises, but I have the strong belief that if we work together, if we do not turn to fear and panic, but if we understand that the way we solve this is by going forward as one people, remembering those who are hurting tonight and will be hurting in the future. This is the richest country in the history of the world. This is a country with unbelievable energy, with unbelievable talent, with incredible resources. We can do it. We can address this crisis. We can minimize the pain, and let us do just that. So let us go forward together. And I look forward to continuing to communicate with you, to tell you where we are coming from, what our ideas are, and look forward to hearing from you as to what your ideas are and what your situation is. So once again, thank you very much for joining us this evening. Good night. Good evening, everyone, and thank you all so much for joining us this evening. And let me begin by thanking Andre Simone for his music. As all of us know, we are facing an extraordinary and unprecedented crisis in our country and around the world. We are looking at a global healthcare crisis as the coronavirus spreads throughout our country and throughout the world. And as a result of the growing healthcare crisis, we're looking at an economic crisis hitting our country. Today, all over America, working people are learning that they're no longer going to have a job. In many cases, they have no money in the bank, and they are worried about how they're going to put food on the table for their kids. And later on this evening, we're going to hear from two folks who are very knowledgeable about what's happening on the ground in terms of working people as this crisis expands. Sarah Nelson, as some of you may know, is the president of the American Association of Flight Attendants, and everybody knows that the airline industry has been hard hit by the crisis, and we'll want to hear from Sarah and get her views as to how she thinks the Congress should respond to the crisis. And Saru Jayaraman is a representative of the Restaurant Opportunity Center, and they're doing great work in representing the needs of workers in restaurants and in the tourism industry all over this country. Because again, as everybody knows, restaurants, bars are being shut down, and many hundreds of thousands of workers are being laid off. So we'll want to hear from Saru's thoughts about how we can best proceed. In this extraordinary moment in American and world history, we have got to think outside of the box in a way that we have never done. This is an unprecedented moment, and we have got to think in an unprecedented way. And that means in terms of government action, in terms of our own behavior, how we make sure that we are not infecting other people, in terms of making sure that we are not turning our backs on the weakest and most vulnerable people in our country and in the entire world. So this is a moment that history will look back on and say, how did the people of the United States respond? Did they stand together? Did they come together? Did they panic? Did they turn on each other? And clearly our goal is to bring people together, to care for each other, to love each other, to respond with compassion, to understand that if we stand together in this very difficult moment, we will come out of it. Not without danger, not without death, not without sickness, not without economic pain, but we will come out of it if we stand together. And let me just begin by responding to the Republican plan on the coronavirus epidemic that was presented yesterday by Mitch McConnell, who is the majority leader in the U.S. Senate. And I have to say, without wanting to be tonight very partisan, to say that the Republican plan on its face is totally inadequate. The Republican proposal provides massive tax breaks and subsidies to the wealthy and very large corporations, while providing little to no assistance to the people most in need, and that is our lowest income people and working families all across this country. This is a proposal which has distorted ideas, protecting those who don't need that much protection and ignoring the pain that so many Americans are today feeling. The Republican bill gives Trump's Treasury Department enormous flexibility to bail out the airlines, to bail out cruise ships, to bail out hotels and the tourism industry, while providing no funding to help the homeless or the most vulnerable people in our country. And that is a set of priorities that is just unjust and unfair. If you are a couple making $150,000 a year, you're doing pretty well. Under the Republican proposal, you would get a $2,400 check for $2,400. But if you are a senior citizen trying to survive on $13,000 a year from Social Security, you would receive a check for $600, one check for $600. If you are a college student, if you were a college student in 2018 who just got laid off from work last week, you would receive nothing, zero, from the Republican proposal, although you may have virtually nothing in the bank. In other words, this Republican proposal is a set of ideas that should go nowhere, should be rejected by the Democrats in the Congress, and we should sit down and work out a set of policies that work for working families, not just large corporations. And right now, as a senator from Vermont, as a member of the Democratic leadership, I am attempting to do just that. So without giving you a very long speech about all of the details that are involved in a serious proposal, I want to just outline some of what, in my view, I want everybody to understand this, and I think our guests later in the show are going to talk about this. Today, in America, unemployment offices are being flooded with applications from workers who have lost their jobs. The Secretary of Treasury recently said that unemployment in America may go as high as 20%. So all across this country, we have a situation where half of our people are living paycheck to paycheck. Under good times, they are struggling economically. We have a situation where 40% of the families in America cannot afford a $400 emergency. For 40% of the families, if their car breaks down, they're going to have to figure out how they get the money to repair their car. In other words, many of our people are already living in dire economic straits. And now, for many of them, they've lost their jobs. Their paychecks are stopping. So what we have got to do is to make certain that every single American receives the financial assistance they need to survive this crisis with dignity. Let me repeat that. A basic underlying principle of what we must do in Congress right now is to make certain that every American receives the financial assistance they need to survive this crisis with dignity. Those are people who have jobs today. Those are people who are unemployed. Those are senior citizens living on Social Security. Those are the homeless. Those are people who are in jail. Those are every aspect of our society must understand that in the midst of this terrible economic and health crisis, we are one nation, and the United States government is prepared to make everybody whole. Now, no matter what the government does, no matter how good the proposals are, everybody in this country, or most of us, are going to be living under a great deal of stress. are we going to get the coronavirus? Are we passing it on to somebody else? What does it mean that our kids can't go to school? What happens if we have a mom or a dad in a nursing home where those people are so vulnerable to this crisis? So there's enormous stress that everybody in this country is experiencing. But in the midst of all that, the least that we can do is to make sure that all of our people receive the financial support that they can get. And I would say this is not just a radical idea coming from Bernie Sanders. As some of you may have heard today, the conservative government in the United Kingdom announced that workers there would receive a check from the government equivalent to 80% of their salaries. Denmark, I believe, had a program in which workers would get 75% of their salary. So ensuring that all working people do not suffer during the midst of this economic crisis is truly not a radical idea. It is a humane idea. It is exactly the right thing to do. Now, there has been a serious and I think productive debate in the Congress about how do you get the checks out? What is the mechanism? Because right now I worry and you worry that there are people who may not have the cash in the pocket they need to go out and buy the food to feed their families. They don't want to wait a month. They don't want to fill out 100 forms. They need those checks coming to them immediately. And in the midst of that debate, I think the growing consensus is that the fastest way to get a check sent out to people, or direct deposit, as the case may be, is through an immediate expansion of the unemployment program. And right now, as I think some of you may know, the unemployment program is a result of all kinds of cutbacks, terrible cutbacks over the years. The result is that now approximately only 25% of workers in America are eligible for unemployment. So if you're a waiter, if you're a waitress, if you're an Uber driver, if you're doing you're an independent contractor, if you're doing one of a dozen jobs, you may not be eligible for unemployment. That has got to change. So the goal here is to say that we're going to greatly expand unemployment to cover every worker in America. We're going to provide 100% of the salaries that those workers were receiving so long as this crisis exists, with a cap of $75,000 a year. We also, in addition to that, because of ancillary costs that families are going to incur, we need to provide a $2,000 monthly payment to every man, woman, and child in America until this crisis ends. Now, the Republicans are talking about one check. What in God's name does a $600 check or a $2,000 check mean one time when you are unemployed? Yes, it may get you through 3 weeks, maybe stretch it to get you through a month, but that is nowhere near what the working people of this country need and should have. Furthermore, we need to recognize that as the only major country on earth, and this is a long-term disgrace and long-term and ongoing disgrace, we need to make sure that every worker in America has paid family and medical leave. We are the only major country on earth that doesn't guarantee that. That has got to stop. That has got to stop right now. Furthermore, I've talked a little bit about the economic impacts, which everybody is nervous about. But obviously, people are even more nervous about where we are from the coronavirus epidemic. In my view, we need an unprecedented emergency response to our current and growing healthcare crisis. In my view, we need to immediately provide the equipment that medical personnel need in order to protect themselves and do their jobs. Unbelievably. And again, this speaks to the dysfunctionality of our healthcare system and the lack of preparedness for a crisis like this. Can anyone believe that all over America, doctors do not have the masks and nurses do not have the masks or the protective gowns or the gloves that they need? And what has got to happen under the Defense Production Act, we have got to begin producing all of the equipment that our doctors need, because as I think everybody understands, that if our doctors, our nurses, our medical personnel go down, and some of them are already being infected with the virus, and they are incredibly vulnerable because they're face to face every day with people who have the virus. If our frontline defense goes down, then we are in really, really serious trouble. So we've got to do everything we can immediately, as quick as possible, make sure that we are protecting our medical personnel. Furthermore, and again, I think this is a no-brainer, but some in Congress don't agree with me, during this crisis, we need to make certain that everybody in our country who needs to go to a doctor for whatever reason gets the health care they need regardless of their income. There is a lot of discussion right now which says, well, you know, if you have the coronavirus, the government should make sure, the insurance companies should make sure that your testing is paid for and your treatment is paid for. That's fine. But what happens right now if you are diagnosed with a serious other illness? Are you going to go bankrupt now because you've been diagnosed with cancer or heart disease, or somebody in your family has Alzheimer's? So I think right now, and there are various ways to do that, we've got to make sure that every person in America has the health care they need. And this problem is becoming more acute, because when a worker loses his or her job today, they're not only losing that income, they're losing the health care that many private employers are providing. So there are ways to do that. I think the simplest way to do it probably is to make sure that Medicare covers all of the people who are uninsured or underinsured, and make sure that nobody in this country who has private insurance pays any out-of-pocket expenses. In other words, if you have a deductible, you should not have to pay out-of-pocket. If you have a co-payment, you should not have to pay out-of-pocket. That's Medicare filling in that gap. So the fight clearly continues to do what every other major country on earth has done, and that is provide health care to all people as a right. But right now, in this emergency, we must make certain that all Americans have all the health care they need above and beyond the protections they need for the coronavirus. Furthermore, we need to make sure that we provide the testing that everybody in this country needs, and that we move forward. And I know there's a lot of work going on in the country right now, that we move forward to do it in as quick a time period as we can. There are processes out there which in a few hours can let you know whether or not you have the virus. And what's important about that is you don't want people who do not have the virus to be occupying hospital beds. We want those beds available for people who need it the most. So there are procedures out there being developed in our country and around the world to expedite the processing of the coronavirus, and we should move on that and invest in that as significantly as we possibly can. Now, above and beyond making sure that all of our people have health care, that all of our people get the testing that they need, and that those tests are processed rapidly, making sure that we have enough ICU units, that we have enough ventilators, that we have enough hospital beds. Above and beyond all of that, we are going to have to provide a massive amount of money to states and cities throughout this country. There are some states now, as I understand it, that are less than a month away from not being able to pay their employees. And if our cities and our states are unable to pay their employees, if we don't have that workforce available, it will make it almost impossible to deal with the crisis. Furthermore, in the midst of this dual crisis of coronavirus and the economic meltdown, we need to make sure that we protect the weakest and most vulnerable people in our country. And I'm thinking right now that in my own state of Vermont and all over this country, you got elderly people on very low fixed incomes who are worried about if anyone is going to visit them, how they're going to get the nutrition that they need. So we need to be expanding in a significant way, the Meals on Wheels program, the school meals program, and the SNAP program, so that nobody in America goes hungry during this crisis. I mean, that's kind of something that is, I think, very basic. We have to make sure that everybody has the nutrition they need. In addition, we must place an immediate moratorium on evictions, foreclosures, and utility shutoffs, and suspend payments on mortgage loans for primary residences and for utility bills. And when I'm talking about utility bills, we're certainly talking about telephones, because if you don't have a telephone, you're not going to be able to communicate with anybody if you are trapped in your house. And by the way, we're talking about making sure that people can continue to have cable TV, because there's going to be a lot of information distributed via television. I don't want people's TV to be shut off as well. During this crisis, we need to make certain that no one loses their home, and that everyone has access to clean water, to electricity, to heat, and to air conditioning. In other words, the basic necessities of life must be continued regardless of the financial situation of the individual. We must also provide funding for states and localities to provide rental assistance. So it's not only preventing people from losing their homes, we will not accept millions of people facing eviction because they can't pay their rents. Furthermore, we should be covering all student loan payments for the duration of the emergency. If people don't have income coming in that's significant, they cannot be asked to pay off their student loan payments. And we must ensure that the homeless, survivors of domestic violence, and college students quarantined off campus are able to receive the shelter, the health care, and the nutrition they need as well. To the degree, on another very important issue, when my Republican colleagues are talking about bailing out the airlines, they're talking about bailing out the tourism industry or the cruise ship industry and other large entities, we must make certain, in no uncertain terms, that no bailout results in profiteering or unusual benefits going to the CEOs of these corporations and to the corporations themselves. This is a moment in which we are all in this together. This is the equivalent of a war, and we cannot allow large corporations to be profiteering. We cannot allow the drug companies to be profiteering in this moment. Any emergency credit extensions or loans to insolvent companies or industries as a result of this crisis must come with strict protections and benefits for workers, for unions, and customers, not no strings attached bailouts for executives. And that is a very important principle that we must operate under. We will put and must put conditions on this financial assistance to make sure that any corporation in America that benefits from emergency aid does not lay off their workers and pays workers a livable wage. In other words, if the government is going to provide assistance to large corporate interests, they must protect their workers. Furthermore, as work around the globe takes place right now, and we've got to invest in that as well, for a vaccine to treat people and prevent the spread of this terrible epidemic, we must make certain that the pharmaceutical industry, which has a long history of profiteering and greed and corruption, does not use this moment to profit from the pain and fear of so many people. Further, all prescription drugs that are developed with taxpayer dollars must be sold to the American people at a reasonable price. It is outrageous, unspeakable. Taxpayers put huge amounts of money into the development of drugs. The drugs are developed, and then the companies charge outrageous prices such that many people can't even afford the drugs they help to pay for development. The pharmaceutical industry during this crisis must be told in no uncertain terms that the medicines that they manufacture for this crisis will be sold at cost. No profiteering here. All right, let me, right now, we're going to have to, for technical reasons here, we're going to go to some music, and that music is going to be provided to us from NACO. And after we hear the music from NACO, we're going to be having a discussion with Sarah Nelson, who will talk to us about one of the industries hit hardest by the economic downturn, and that is the airline industry, and what that means to the people in her union who are the flight attendants. So stay tuned for some really good music, and in a few minutes we're going to come back with Sarah Nelson, president of the American Association of Flight Attendants. See you in a minute. Good evening, everyone, and thanks so much for joining us tonight for what I hope will be an important discussion addressing the unprecedented healthcare and economic crisis facing this country. What we're going to do tonight is I'm going to chat for a little bit about what's going on in Washington, what I think should be going on in Washington, and then we're going to bring on separately and then together three of the outstanding members of the United States Congress, Alexandria Ocasio-Cortez, Ilhan Omar, and Rashida Tlaib. And they will speak separately, and then we'll engage in a discussion together. And I wanted to have them on this virtual town meeting. They represent different parts of the country, and I wanted to hear from them what's going on in their communities and where they think we should go as a country. We're also very appreciative tonight that we have a grandson who is going to provide some excellent quality music as we move the program along. This is, as I think everybody knows, a moment in American and world history that nobody alive has ever experienced. We're dealing with dual crises. We're dealing with a healthcare crisis in terms of the coronavirus, which is spreading all over our country, has spread all over the world, will kill many, many millions of people throughout the world. And we are dealing with an economic meltdown of enormous significance, impacting the world and impacting our own economy as well. And let me begin by saying to you that, my goal tonight is not to be partisan. I think the last thing that the American people want to be hearing is some kind of partisan attacks. Everybody is worried, everybody is concerned, and they want to know where we go from here. But I do have to say that I was really stunned to read aspects of the Republican bill that has been proposed. It's not going to go anyplace. I think the Democratic caucus will not accept it for a second. But it is hard for me to believe that in the midst of this terrible crisis, that we have a Senate Republican bill that would give the Trump administration a blank check to hand out corporate welfare to virtually any corporation in America without conditions as to how they can protect workers in this country. And that obviously is not going to happen, but that is what they're coming forward. And right now we have, again, unbelievable as it may seem, I am more than familiar with corporate greed and the power of lobbyists, but to think that at this moment, when we have doctors and nurses putting their lives on the line to protect the American people, you have corporate lobbyists who are working overtime in order to receive special benefits for their corporations. And let me just give you a few examples so you'll understand how vulgar some of what is going on is. We're hearing from the airline industry, which is admittedly hard hit. They want a $50 billion bailout, but they are not talking about how they're going to protect the workers in that industry. We're talking about, this is quite amazing, the private space industry. Remember, This is the midst of a coronavirus epidemic. The private space industry is requesting $5 billion to benefit people like Jeff Bezos and other billionaires. The candy industry, again, a crisis in which millions of people are going to get sick, many will die. The candy industry is online for a $500 million to benefit the likes of the Mars Candy Bar family. And, this is a family that is one of the wealthiest families in America, worked very hard to reduce taxes for the rich. They're in line. The hotel industry wants $150 billion. And by the way, one of the recipients of that bailout would be the Trump family. The National Association of Manufacturers, who in the past have shut down factories in America, moved to China, moved to Mexico, been at war with the working people in this country. They're online, man. They're there. Their lobbyists are there. They want $1.4 trillion in assistance. Obviously, that is just astounding to me, and I think the American people. Apparently, the greed of some of these people has no end. In my view, and I think the American people are united on this, we need policies now which benefit the working families of this country, that benefit low-income people, that benefit the most vulnerable. We're not here to give handouts to large corporate interests without any strings attached. Let me say a word about the healthcare crisis in terms of what we have got to do. One of the things that I find astounding is that, and it speaks volumes about the dysfunctionality and the absurdity of the current healthcare system. One might think that at a time when we are spending $11,000 for every man, woman, and child, twice as much as the people of any other country, one might think that we would be prepared for an epidemic in terms of making sure that our medical professionals, our doctors, our nurses, and other people who are in day-to-day contact with people struggling with the coronavirus, you might think that they would have the masks that they need, that they would have the gloves they need, that they would have the protective gowns they need in order to do their jobs. The truth is, as I think many of you know, they do not have that medical equipment. And right now, we are seeing in this country and around the world, medical professionals getting sick because of their exposure to the coronavirus. And this is not only a tragedy for the doctors and the nurses and the other medical profession, it is a very frightening situation for our whole country. Because if our frontline doctors and nurses go down and are unable to provide the care we desperately need at this moment, who is going to be there to protect the millions of people who are sick? So what we have got to do right now is to understand that at this moment, the President of the United States has got to fully utilize in an extremely aggressive way the Defense Production Act. And what the Defense Production Act states is that the president has a right to tell a private company, you know what, instead of manufacturing t-shirts or underwear or socks, not exactly what we need right now in the midst of this crisis, you will start production in terms of masks, in terms of gowns, in terms of gloves, in terms of the other equipment that our medical professionals need. Now, the good news is some in the private sector, some companies are already making that transformation, and I applaud them. And these companies deserve to be adequately compensated for the work that they're doing. But what we need is at a time when experts estimate that the United States alone, I'm not talking about the rest of the world, our country alone, may need a minimum of hundreds of millions of masks, because they are disposable. You don't reuse them. You should not reuse them. Of masks and gloves and gowns in order to get through this pandemic, what the President of the United States must tell various companies is, you're going to stop producing what you're producing today. We need you to produce the products that our doctors and nurses and medical personnel needs. In addition to making sure that our physicians and nurses have the protective equipment they need to protect their own lives so that they can continue protecting the American people, Trump must order the immediate production of ventilators, ICU units, test kits, and the agents needed to process those tests. We are woefully behind in all of those areas. There are apparently tests now being developed which can give results in less than an hour. And that is enormously important, because what we don't want to do is have hospital beds filled up with people who do not have the coronavirus. We want to make sure that those beds are there for the people who need them. And rapid processing of these tests is terribly important. So on an emergency basis, we've got to get these tests done, we've got to get the processes done, and we need to move on this as aggressively as we can. Furthermore, we must increase the availability of mobile medical units. That means if hospitals don't have the beds that they need, the ICU units they need, there should be units placed alongside the hospitals. And I suspect that the Department of Defense and the Veterans Administration can play an important role in that process. Bottom line is that we are facing an unprecedented medical crisis. We need an unprecedented medical response. And the president has got to utilize all of the tools that he has in order to protect the American people. Second issue I want to say a few words on before we bring on the Congresswomen, and that is to talk about the economic impact of the epidemic we are experiencing. Nobody, of course, can predict what the economic fallout of the epidemic is, but we all know that it's going to be very, very severe. There have been estimates out there that within a few months, unemployment in this country might be as high as 20%. There was an estimate coming from the Federal Reserve in St. Louis suggesting that by June, the unemployment rate may be even 30%. And that is on top of the reality that the stock market has suffered massive losses, which means many, many Americans are worried about what their retirement will look like with these losses. All of this suggests that what we may, and hopefully we're wrong, nobody knows, but worst case scenario, we are looking at the worst economic downturn since the 1930s. And in the midst of not only this healthcare crisis, but the economic downturn, the United States Congress and the President of the United States must act in an unprecedented way, and in a way that meets the needs of the working families, the middle class, the lower income people in this country, the most vulnerable people in this country. Our job right now, and this is stuff, we have no history for doing this, but this is what we've got to do now. We've got to make everybody in this country feel confident that they will be protected as this crisis unfolds. And let me just give you an example of the kind of problems that we are dealing with. Let me just quote from an article that appeared in the Washington Post this afternoon. Quote, since Nicole Kane lost her job as a Haas's Steak and Sea House waitress Monday because of the spread of the coronavirus, all she can think about is April 1st, when her mortgage and car payments are due. Kane's husband works at Panera, which is still open for takeout in their small town of Lebanon, Pennsylvania, but business has been slow, making the couple fearful for his job as well. The family has 3 children and 2 car loans, end of quote. Suspending mortgage and car payments for 3 months would be the biggest impact for my life, Kane said, end of quote again. So here you have a family, a wife lost her job, husband may lose his job. They got a mortgage payment, coming up on April 1st, and they have car payments on 2 cars. That is their reality. And what happens if they have no income? What happens? Are they going to be able to keep their house? And that's just one example. There are millions of examples. Last night, 2 nights ago, we talked to a representative of the restaurant workers organizing effort. And she was talking about millions of workers who are living on tips. They're making $2 or $3 an hour on tips, on salary, on wages, and then they get tips on top of that. These people have nothing in the bank. What happens when they lose their job? What happens to millions of people? The 40% of American people do not have $400 in the bank for an emergency. So you got half of our country living paycheck to paycheck, and now suddenly those paychecks stop. How are they going to feed their families? How are they going to keep their telephones? How are they going to keep their lights on? What happens if their kid gets sick? How do they get to a doctor? So there is enormous economic anxiety taking place all across this country. Let me just very briefly touch upon what other countries are doing in response to the crisis. In the United Kingdom, in Germany, in Denmark, and in Norway, these countries are moving aggressively to guarantee 75, 80%, and in some cases 100% of the paychecks of workers in businesses that commit to not laying off employees. In other words, in one of those countries, if an employer says, okay, we're going to keep you on the payroll, the government is guaranteeing between 80% and 100% of that paycheck. And in my view, that is exactly what we should be doing in this country right now. Is that a radical statement? Of course it is. But these are unprecedented times, and we must spend whatever it takes to make sure that every family in America is made whole, is not made desperate by this crisis. And so it is my view that workers who are unemployed, regardless of their previous eligibility for unemployment, and that's an important point because right now, unbelievably, most workers are not covered by unemployment compensation. And we got to throw that out of the door and make sure that every worker, whether you're driving an Uber car, whether you are a waitress, whether you're a waiter, whether you're a so-called independent contractor, every worker in America needs to know that he or she is going to be able to retain their income up to at least $75,000 a year. In addition to that, we need to provide $2,000 monthly, every month, payment to every man, woman, and child in America until the crisis ends. I know some of my Republican colleagues are talking about, gee, a one-time $1,000 payment. Really? Really? Yeah, that'll last you for 2 or 3 weeks. And what happens after that? Once again, in this unprecedented moment in American history, we must act in an unprecedented way, no matter what it costs. And that means to guarantee to every man, woman, and child in this country that we will make them whole, that we're not going to leave them out hanging, losing their homes, getting evicted from their apartments, losing their ability to communicate. Furthermore, we need to make sure that every worker in America has paid family and medical leave, not just the 20% of workers who are currently have that benefit. Again, we are the only major country not to guarantee paid family and medical leave. That is beyond pathetic. And in this crisis, we have to make sure that workers do not go to work when they are sick because they are fearful of losing that paycheck. That is insane, and that is something that has to be done right now. Furthermore, we must make sure that the measures that I'm talking about apply to everyone in this country, regardless of immigration status, and they must apply equally to tribal and territorial communities as well. That means Puerto Rico, that means our other territories, That means those people who are undocumented. This is not the time to play stupid games. We are all in this together. In my view, on top of what I have just said, I worry very much about this crisis' impact on the healthcare benefits of ordinary Americans. Now, everybody knows that I am a strong advocate for Medicare for all, and we've got to join every other country on earth in guaranteeing healthcare to all people. But right now, at the very least, what we should be doing is saying to those workers, the millions of workers who are losing their jobs, you know what, relax. You and your family are gonna have health care. We're gonna expand Medicare to cover you. Now that means changes in Medicare because Medicare now does not cover the needs of children. It's not pediatric care. We have to change that. But I want every worker in America to understand that he or she and their families will be covered when they lose their jobs. And on top of that, if you have private insurance right now, you got a $5,000 deductible. We should have Medicare covering those needs so that you do not have to pay out-of-pocket expenses. Furthermore, we need to protect states and cities right now because tax revenue is plummeting. We are seeing states and cities who may not be able to make their payrolls in several weeks. And that is a disaster for the municipal and state employees, but it is also a disaster of everybody because these state and municipal workers are the people who are providing the services that we need in the midst of this crisis. So there must be a significant amount of money going to the states and the cities, and one approach is to have the Federal Reserve act aggressively and forcefully to buy short-term municipal debt securities. And this will help stabilize state government finances and provide states and cities with the financial support they need to address the health and economic crisis. Furthermore, and again, I'm only giving you an outline of some of the basics here. I mean, we can go on for hour after hour after hour dealing with all that has to be done in this crisis, which is impacting every single one of us in this country. We have got to be mindful of the most vulnerable people in this country. Right now, there are elderly people who are sitting home alone and they're worried. How are they going to get the food that they need? How are our people going to make sure that all of us have the nutrition, the housing, the clean water, the electricity, and the basic necessities of life that we all need to get through this pandemic? So that means, among many other things, expanding the Meals on Wheels program, which delivers meals to elderly people. It means expanding the school meals program. If kids are not in school now, how are they going to get the nutrition they need? We got to make sure that the kids are adequately fed in this crisis. It means expanding the SNAP program. Bottom line here, it means that in the richest country in the history of the world, in this crisis, nobody in America goes hungry. And I'm talking about the homeless, I'm talking about the disabled, I'm talking about everybody in this country. Furthermore, what it means is putting an immediate moratorium on evictions, on foreclosures, and utility shutoffs, and suspending payments on rent and mortgage loans for primary residences. It means also restoring utility services to any customers who have had their utility shut off. I think later on in this program, Congresswoman Rashida Tlaib of Detroit is going to be talking about the insane situation in Detroit, where you got thousands and thousands of households who have no running water. Yeah, in America, all over this country, there are people who do not have running water, and we're telling everybody, wash your hands 10 times a day. We got to make sure that everybody in America has basic utility service. Furthermore, I worry very much that we have a prison system in this country, state prisons, which are already disasters. We have heard the horrible things happening. There is a fear that if we don't get our act together, we could see the coronavirus spread in those prisons. We got to make sure that we are protecting those people, and we also have to make sure that we are protecting the homeless. Last point that I want to make before I introduce our guests is that we have got to do everything we can to stop the profiteering that some corporate interests are now engaged in. There are reports that the cost of rubber gloves is now soaring because people understand there's an enormous demand for them. They can charge any price they want. My good friends in the pharmaceutical industry, which is probably the most corrupt industry to begin with, are already seeing how they can make more profits right now in the midst of this crisis. So the word has got to go out, and if Trump can't do it, and I doubt that he can, Congress must do it, and say that right now, when we have doctors and nurses, when we have police officers, when we have EMT people putting their lives on the line, when we have teachers doing everything they can to make sure that our kids continue to get the education they need, when we're seeing the best in human nature, millions of people doing the right thing in this crisis, we will not accept profiteering and greed and corporations and individuals trying to rip off people in the midst of this crisis. Not acceptable. And I don't think Trump can do the right thing on this, but Congress must do the right thing. And we must be very loud and clear on that. So let me just conclude by thanking everybody for being with us. And what we're going to do right now, because I think it's a good thing to do, but because of the technological limitations we're under here, we're going to hear some music from the artist Grandson. We thank Grandson very much for helping us out tonight. And after we hear from Grandson, we're going to come back and we're going to hear from Congresswoman. I believe the first one we're going to hear from is Alexandria Ocasio-Cortez. Then we hear from Ilhan Omar from Minnesota, and then Rashida Tlaib from Michigan. I think that's the order. It may be changed, but that's what I would like to do. So let's now hear from Grandson for a few minutes, and then we'll be back with Congresswoman Alexandria Ocasio-Cortez. And then after each of the members of Congress speak, we're going to open it up for a discussion. So thanks very much for being with us.